lot. I mean, I think it's amazing just in the short span of time, and you guys have grown into such a powerful force. And many of my colleagues, both in the dermatologists as well as medical oncologists, surgical oncologists, have sort of became involved with your organization. I know all the great work you guys are doing. Now, from the patient's perspective, can we first talk about from the educational component? Obviously, once you get the diagnosis of melanoma, I call that like the mad rush phase. You're so anxious, right? You want information. How do people, did they just go onto your website, or is there a better way to access this information?
Yeah, that's a great question. And I think, human nature is when you are dealing with any type of diagnosis, you go to Google,
Yeah,
right?
yeah.
Unfortunately, a lot of the information that you're going to find might not be the most up to date or the most reputable. So, what we really encourage people to do is come to our site. And whenever you're dealing with a cancer diagnosis, I would encourage any patient to really find information from an advocacy organization, because you're really going to get unbiased information. You're going to get up to date information. So many people do come to our website, again, melanoma.org first, to learn about their disease. And we have a ton of resources for patients, recently diagnosed patients, patients who might be dealing with even a stage 4 diagnosis. We have a lot of tools on our website. So whether they're looking to find a treatment center, we have something called a treatment center finder, where they could find where they could be treated in their community. We have a clinical trial finder, which is also another great tool. There's over 1,000 clinical trials right now in melanoma. And it's really overwhelming. If you go to clinicaltrials.gov, it's just a really hard site for
Very
patients.
difficult site.
Yeah, so we really try to make it easy for patients so that they can get information and then again, go back to their doctor. What we want them to do is take the information back to their doctor, have the conversation, right, about what their options are. And then we have other great resources for caregivers as well, who really are oftentimes the ones finding the information because it's just so overwhelming for the patient. So they're really being their loved one's advocate and finding the resources. So a lot of caregivers come to our site as well. And we have tools there that take really big concepts and distill them down into videos. We have these animated melanoma patient videos that are fantastic that, again, take big therapies or big questions and take them down to 7 minutes of animation where they can learn more, but it's not so complicated. It's not in medical jargon, it's really in layman's terms.
Yeah, I've actually, so in the process of writing this book and sort of doing this video interviewing all the experts, I've visited your site. I think it's very, very helpful. And we're definitely going to put some of the links, and especially, the treatment centers and as well as the clinical trials. And I think we don't talk enough about the clinical trials, right? And even though we made such enormous progress, but there are still patients that are failing the standard immunotherapy or targeted therapy. And you're absolutely right. The clinicaltrial.gov site is pretty difficult for layperson, and because there's so much information there.
There's so much, and it's such an overwhelming time for patients anyway, who are
Yeah.
dealing with their personal lives and work and trying to navigate treatment, how they're getting to treatment, how they're paying for treatment. So anything that we can do to alleviate or make it easier is our goal. And we have a new program that we've just relaunched. It's called Ask a Nurse. So we
Oh,
have a
wow.
nurse with staff, and her email is askanurse@melanoma.org. And people can email her if they have questions. And that's a real person that's available to patients to answer questions. Because I think a lot of times too, maybe you can't reach your treatment team, or maybe you asked a question or you forgot to ask a question when you were seeing your doctor. So it's just another resource for patients while they're going through.
And then is that nurse actually giving medical advice, or is it, I mean, just thinking from the medical legal perspective?
Yeah, so not medical advice. She's
Okay.
pointing them to resources.
Plain
So
resources.
yeah, so she's helping connect them to resources. So sometimes there's questions about insurance reimbursement, or maybe it's a question about a caregiver resource. So what she's doing, she's really connecting the dots for patients and getting them to resources or other groups that are providing those resources for them.
It's
So
only
financial,
specifically tailored for melanoma patients.
Yes, only melanoma patients. And a lot of the questions we get are surrounding financial assistance.
I see.
So she's able to direct them to the right resources for things like that.
And then financial resource, I mean, I think this is one of the biggest barrier a lot of patients
Yeah.
face because, especially dealing with late stage stage four, some of the immunotherapies, they can be very costly.
Yeah.
So what are some of the resources that are available out there?
So there's a lot of really fantastic groups that help with some of the financial barriers
Mm.
that exist for patients, and we have them on our website. The one group that does great work is the Pan Foundation, and they help with the financial assistance piece. But again, it's very overwhelming. Sometimes the funds are limited, or sometimes they have the funds available and they dry up quickly. So what we really help patients do is sort of navigate the
I see.
many different resources that are out there so that they can get to the right place. And it's hard for patients to do that on their own.
No,
It's
it's
hard
very
for them to
difficult.
sort of figure out where to go and who to talk to. And, again, it's time consuming. So if we can really help eliminate some of those obstacles, that's really what our goal is to make it easier for patients and their loved ones so that they can get where they need to get quicker, more efficiently, more effectively, that'll lead to better outcomes.
Yeah, I think what you guys are doing is so special because, as a physicians, we sort of focused only on the medical aspect, right? We're only thinking about the medical aspect for that patients, but you're looking at this from the comprehensive manners that not only addressing you, educating the patient and you directing to the right place, you're sending them to, possible tertiary care centers. But this piece about financial support, how to get the financial resource for the patient and the caregiver is something I think it's missing. Not too many organizations is doing. So it's a really, really great, valuable resource.
Yeah, yeah, it is. It really helps. And again, we are not the ones giving the financial resources, but we're the ones connecting them with the groups that are. So it's really, that one-to-one
Yeah.
relationship, which is really